Hello, this is Stephen Zuckerman in Baton Rouge, Louisiana, and I'm going to give a little talk on multiple sclerosis. And I'm going to break it up into three different sections, and this first bite-sized piece is going to be a little bit of the essentials of the epidemiology and pathophysiology of MS. So we know that multiple sclerosis is an inflammatory condition which affects predominantly the myelin sheaths and the myelin producing cells called the oligodendrocytes that are involved in the central nervous system only. So brain spinal cord without peripheral nerves involved because their myelin is produced by Schwann cells. And the problem when myelin breaks down is that the normal saltatory conduction in which the electrical impulses jump from one node of Ranvier to the next in an efficient and very rapid fashion breaks down, and those nerve signals are not transmitted properly. The epidemiology, 0.1% of the population worldwide, which breaks down to 400,000 people in the United States having multiple sclerosis. It is predominantly at least 2-to-1 women to men. Men, however, are more frequently afflicted by a worse prognosis because they have a primary progressive MS. There are both genetic as well as environmental factors that are involved in this condition. A small percentage of MS patients have first-degree relatives, and it's thought that there may be some genetic component. And for a long time, it has been observed that the further away from the equator you are, the higher risk you are of developing multiple sclerosis. There is also a migratory factor. For example, people who come from Africa have a considerably less chance of developing multiple sclerosis, but if they migrated to the United States between the ages of 5 and 15, they also take that increased risk of having the disease. In terms of pathophysiology, it's clearly an autoimmune disorder which entails the breakdown of the blood-brain barrier so that T cells, lymphocytes, adhere to the endovascular portion of the brain, blood vessels, and then go into the brain itself, and they're not under the normal suppressor cell influences. They develop into effector cells, and they can attack the myelin both directly and through the use of their various cytokines and activation of macrophages, produce breakdown of the myelin and the oligodendrocytes. And that's pretty much it for the epidemiology.